Hi, this is Dr. Sabari Prabhu. I'm working as a medical administrator and the resident medical officer in Bhagirathi Medical Center and Hospital located in Tudiyulu on Mettupalayam Coimbatore Highway. I've been working as a medical administrator here for the past 5 years. Before that, I have completed my MBBS on 2016 in Chennai, and after that, I have been working in Build Hospitals and Care Hospital for quite some time. After coming here, I joined here as a duty doctor and gradually improved into a resident medical officer and a medical administrator here. The medicine part where I'm passionate about is the critical care field and the emergency medicine, because in emergency medicine and critical care, you can literally save a patient by exactly diagnosing the patient, and you'll get an addiction to that field, because while you save a patient from a critically ill phase, and the reaction from the patient and their relatives is very very addictive and you cannot get over it. This is what the most important thing in this field of work, because you are not concerned about your money as a doctor, you are concerned about a service as a doctor, which this addiction will help you go towards that services. Literally, I don't care about the money, I am addicted to this profession because of this emergency and critical care medicine in a hospital. For example, I have treated a patient, 25-year-old male patient, quite some back, who presented to us with a cough and breathing difficulty. On examination, just by an auscultation, I found out that his left lung has no air entry. Immediately, I took him to an X-ray, which showed he has an evolving pneumothorax with pyothorax. So we immediately shifted him to the operation theatre and gave him an ICD tube and drained his pus in the lung and air, and then he could breathe better, and he became alright, and he's been leading a normal life nowadays. So while I'm treating the patient, I could see the worried look in the patient's face, whether they could make him alive or not, whether they could take him somewhere else or not. So after the treatment, after he's walking better and is leading a normal life, the reaction in their face is very very happy, thankful and grateful. Even today they became a regular patient to us. So that this type of reaction for a doctor is so addictive. If you get used to this reaction, you won't regret taking the medical field and all. And as a doctor, especially in this emergency and critical care medicine field, you have to dedicate more and more time in a hospital rather than in personal life. You may get very less personal life time, and you should dedicate more of a professional times in the hospital. Literally, I have been staying in the hospital for quite some days during the busy periods. This is where the eMedHub software comes in. So I have introduced this eMedHub software 5 years back in this hospital. While before introducing this eMedHub software, I have inquired lots and lots of software. Everything is concise and comprehensive in a single page. You can look over your patient's treatment plan, you can look over your patient's blood reports, you can look over his patient's vitals, intake, output, urine output, what all medicine he is taking, what are the blood reports we have sent, what are the blood reports which are came back, with a single click in your hand. Either by a laptop or a phone with an internet connection, you can access your patient's information pertaining to your own privacy anywhere in the world. So in medical life, where you have a very difficult time in managing your personal and professional life, this type of softwares like eMedHub comes in handy, so that you can allot a little more time to your personal life. So I can see my patient's whereabouts, I can see my patient's health anywhere, even if I'm at home. Obviously, I need to come here and see the patient and first hand, which is very good, which creates a very good rapport to the patient and the doctor. But if suppose you are held up in a personal work, you are somewhere else, you can trace your patient's progress in the treatment in an IP by this eMedHub software. So this software can be updated by the duty doctors and the staff nurses, which will make you up to date with your patient's condition at present and before. So thank you eMedHub for this opportunity.